My topic is going to speak the borderline embryos. I mean, we are thinking what is the borderline embryos. I am not talking about the morphology and the embryos for CC. I am going to speak this kind of embryos that are the chaotic embryos, and the embryos are coming from 1 p.m. and 3 p.m. because now is the topic in general in this congress. And the first question we have to ask is what is the definition? And when I try to find the definition, what is the cause? And if you go to the book, the chaos is going to tell us is disorder, is confusion, and is mess. And these kind of words are related with the first paper was published by Ledbetter in 2013. And the chaos was like in embryos in day 3, when each cells is going to appear with chromosomically different. But not only this, also in the same year, this paper appeared and they are telling us what is the chromosome instability. And if we go to the chromosome instability, we are going to check that the definition is going to be like identify post-zygotic and specifically instability in the composition of the genetic. Then the synonymous between chaos and the chromosome instability is the same. But what is going to happen when we are performance PGTA in a laboratory? We are going to have different profiles, and we are going to focus in one of the embryos. Always we are thinking if the results it's okay or not, or we have to transfer. And they are going to be these chaotic embryos. And the chaotic embryos, we are going to check later that the definition from the genetic laboratory you are working is totally different. Then in our case, in our laboratory, with the genetic laboratory we are working, the definition is more than 5 anomaly chromosomes. But depending what the genetic laboratory you are working, this definition can be different. Then if we check what is the literature or the papers about the chaotic embryos, only we have a few, and in the 2 years ago in the CRN appeared this poster and is telling us what is the positive predictive value about these chaotic embryos. Then they study, they biopsy 58 embryos, chaotic embryos, and the results was 38% of euploidy, and the uneuploidy was 95%. Then if we have to check what is the positive predictive value, we have to realize that the effectiveness about the genetic study is tested in this test and in these chaotic embryos is low. 1 year later, the same group, they tried to study if it's related with the classification of the morphology of the embryos. And they tried to check specifically in embryos that they are bad quality because the chaotic embryos appear specific when the trophotodern is the quality C. And related with the date of the develop, they can check that in day 5, they have 1.36% of the chaotic. And when we are growing the embryos until day 7, this percentage is growing. Then we go to the PubMed, and the first case report about the chaotic embryo and with light by rate is this case report, but in this case is no rebiopsy the embryo. And the definition was the 6 or more chromosomes. Totally different, like I told you before, when the laboratory we are working. Then the last year in the genetic congress, they found that also in the data, 44% of the chaotic embryo start to be euploid. The question is, why happen these kind of situations? And the limitations they can have for 3 different points. One is the clinical limitation, such a biopsy of a small number of the cells. The second could be sequencing technology, that they can have noisy results. And the last question is, what is the quality of the biopsy embryos we are doing in the laboratory? But if we are thinking in the chaotic, and also the last year and 2 years ago about the mosaicisms, one of the questions we can have in our brain, what happened with the real aneuploidy? Then we have also to thinking that the aneuploidy, there are no aneuploid? No. And why is these questions? Because when you go to the literature, you can find like different papers that Parag is telling us that aneuploid embryos, they can have like live by rate. But when you read very specifically, concretely, what is the definition about these aneuploid embryos, they are putting all the remix and they have 8 live bears, but they are from segmental and mosaic embryos. They are not real aneuploid. And about the last paper, This is like we don't have to mix in apples and orange because in medicine it's very important the 4P. And the 4P we have to predict, prevent, personalize, and participate. And this is important to have the definition and very clear what is the real definition about not only the chromatic and of the amino weight. This paper is very interesting about Mina Popovic because they tried to do in this kind of aneuploid embryos to do the culture until day 12 and to check and figure out in different parts of the embryos if the real aneuploid we have in the report of the genetic laboratory is 100% aneuploid. Then they try to do this and they check different kind of blastocysts that are aneuploid and mosaic, mosaic only, and euploid. And when they try to give the extension of the culture until day 3, what they found it? They found this kind of characteristic. One euploid embryo, when they gonna have the staining of the stem cells, you can see this kind of embryos. But when we saw the monosomy or the trisomy and they are aneuploid, you don't find the first characteristics from the euploid embryos. And the concordance rate was 100% in all the embryos and embryos. For this reason, we don't have to be afraid what is going to happen when you receive a report from euploid embryos because doing the extension until 12 days is going to have the same concordance rate. Then what happened? I told you before, you have to realize what kind of genetic laboratory you are working because there are 8 different genetic laboratories and the definition about what is the chaotic embryo is totally different. Then I call one by one genetic laboratory to ask them what is the definition from the chaotic. And there are different definitions, and you can see here in different genetic laboratories around the world or around Europe. And one laboratory is going to tell us more than 6 chromosomes, another more than 4 chromosomes, another more than 3, and the 2 and the 5 laboratory also, they don't realize the chaotic embryos. They are going to tell us it's a normal complex, but no chaotic. But it's important the last one, the age, because it's not a laboratory, it's the Genetic Association 1 month ago in the International Congress, and they realized that the definition, the real definition is 5 or more chromosomes, you can define, the definition is going to be chaotic. Okay? And this is important to focus in this definition. What are our experience in our laboratory? We start to rebiopsy embryos with quality chaotic embryos, and we rebiopsy 25 embryos 1 year ago between 2022 and 2023. And the results are this kind of embryos, good embryos, not for BC. The trophy one is sealed. We did a small study, and all these kind of embryos are aneuploid. And when you have embryos and you have chaotic and they have good morphology, my recommendation is rebiopsy. Then we have 92 survival rate when we are gonna do the rebiopsy, and the euploid at the moment was 18%. What happened with the rest? An euploid 77%, and again another embryo was chaotic. And what is the hypothesis or the theory about this kind of chaotic embryos? The hypothesis is normally there are in different kind of patients, especially in repeated implantation failure, they have the predisposition to have this kind of embryos, these chaotic embryos. And if we are going to check the picture number D, in this picture, you can have an embryo with normal fertilization, but in the first cleavage appear specifically three PM or 3 cells that they are the direct cleavage. Then what is the hypothesis with this kind of embryos? There are 2 papers only because it's very new, this kind of studies, and the segregation of the triple chromosome can appear specifically because in these patients you have a mutation, and the mutation is PLK4. And when you have this kind of mutation, you have more percentage to have chaotic embryos. Then there are this mutation associated with a nucleate because in the segregation and the different mitotic division is going to be abnormal. It's going to appear those tripolar spindles in normal fertilized, and it's necessary to start to study in the genetic laboratory this kind of mutation. Then we transfer the embryos, and before was chaotic and biopsy. And until the moment we have two live viruses. And for the reason we change the protocol in the lab. And when we report the good embryos and chaotic embryos, my recommendation is rebiopsy to standardize and to check if it's normal or not for this kind of hypothesis. Right. But what happened with another borderline embryos? And there are embryos are coming from, for example, we know that the normal fertilization is 2 p.m., and suddenly we can have this kind of embryos, 1 p.m. or 3 p.m. The classification, the one of 3 p.m., is more an clinical observation, more than diagnosis. And also, if you have a time-lapse system, can appear this clinical observation because I am going to show you if you have a time-lapse in the lab. And so there are a mixed diagnostics with this kind of observations. What is the origin of this kind of problems? 1 p.m. or 3 p.m. Normally, the percentage in IVF cycles is going to be 2%. When you perform as a microinjection, will be 5%, but there are the three different origins. And 3 p.m. will be the polyspermy outside the random throat meiotic fire. There are the theories are coming this kind of embryos. But we are going to start between 16 and 80 hours, and we can check this kind of problems in the fertilization. We can know that insemination will be by parthenogenesis, like the first line, but we can have asynchrony in the nucleus formation. And what happens if you have a time-lapse system? In the time-lapse system, one pronucleus by enclosing by genomes, then will be both together, and by time-lapse you see 1 p.m., but it's not real 1 p.m. More things can happen, the early pronuclear fusion, and then we can have in the middle this fusion, and you don't see really with the time-lapse, is this a fusion or not, and the diagnostic is 1 p.m., but in original was 2 p.m., depends on what time you are looking for, and also the premature pronuclear decomposition, because the membrane of the pronucleus can disappear and can have this kind of problems. Then, what we have to do, because normally in the regular way in the laboratory, we eliminate them, or we can use regularly. This is the question I am going to give you to the audience. Because normally, if we eliminate, we don't have any risk, and then the patients no risk. But we can have risks, we can do concerning genetic and then have a successful, because now we have the technology. Then it's very important that testing this kind of embryos are coming from 1 p.m. or 3 p.m., and we have to check if it's the balance between the risk and the benefit for the patient. This is the first paper appeared by Julia Soler, and they tried to figure out the topography of the 1 p.m. and 3 p.m. And they check on this kind of embryos, we are going to have 40% diploid, euploid, and heteroparental. Then you can rescue this kind of embryos coming from 1 p.m. And this, Antonia Capalvo also in another paper, they established that 27 blastocysts after the biopsy, these embryos coming from 1 p.m., 69% was diploid. For this reason, the maximum work doing around the world is in Australia, and Clara User, they established more than during 5 years, trying to study what is happening with this kind of embryos and what are the results. And you can see here, depends what is the technique is coming, IVF or ICSI. The positive pregnancy rate and live rate is good because in IVF is almost 38 and ICSI 46. But what is going to happen? The frequency of this chromosomal, the 3 p.m. also, is going to have normal 33%. Then we have different live rate with 1 p.m., but with 3 p.m., we have, when we biopsy this kind of embryos, 33.3%. My question to the audience, is acceptable to eliminate embryos from a normal fertilization now with the data we have and the technology we have? Then we start to study also in our results. And at the moment, we did 17 blastocysts from ICSI and Thai labs, 10 from 3 p.m. and 7 from 1 p.m. in 1 year. And at the moment, the results, 53%, they are euploid. 4 from 3 p.m. and 5 from 1 p.m. But also, we don't have to need only the euploid. Also, if there are haploid or diploid. And we have 3 were diploid. And the rest, there are haploid, triploid, or high monocells. What is the rest? We can have in the laboratory euploid and diploid. In our data, 18%. Then the conclusion with all these limitations about the chaotic or these borderline embryos in our results as a literature that not all the blastocysts from anomalous fertilization have a genetic alteration. And we have to consider to red biopsy these embryos because depending on the patient, you can give a chance to have a baby. But also with the chaotic embryo, it's very important to have these complexities that the patients and clinicians should be aware the chaotic embryos has the potential to produce also live by rate like I saw you before, because we have at the moment only one case report, and now we have now 2 children born. Then it's necessary to continue and study more data. The embryos should have the option of rebiopsy is very important, specifically with what's why what C, but the BB is necessary to rebiopsy because they have a chance to have a euploid. And with one six, it should be standardized by genetic laboratory the definition. You have to ask to your laboratory what is the definition about the chaotic, because depending what is the definition, also you see the variable in the results. And it is recommended that prior to any IVF treatments, it's necessary and the PGA to give the patients the information that they can have this kind of results. Thank you so much.